turn it to your shoulder and bring it all the way back over here. Okay, and bring it down. All right, and then just a quick test of strength. Bring it up, try and turn against my hand. Try turning against my hand and bring it down against my hand. Nice and strong. No pain with any of those movements, correct?
No.
No pain when I manipulated your jaw?
No.
Okay, looking good there. Let's take a quick listen to your, I'm going to palpate your thyroid gland. Of course, let my patient know that I'm going to be standing behind them when I do this, both hands at their neck. Quick feel of the carotid artery here. Nice solid pulse. It is strong, it's regular, and full in its pulsation. And then go ahead, I'm going to have my patient swallow again. I'm going to push the thyroid cartilage to the side and palpate the thyroid gland. It is soft, it is supple. I'm not feeling any masses. So we're good there. And a quick listen for some carotid bruit or sounds over the thyroid gland. Why don't you take a deep breath and hold it for me, please? Nice solid pulse here. Not hearing any carotid bruit. Go ahead and breathe. So, we're going to move on to the ear portion of our assessment. I'm going to tap this here. I want you to tell me if you can hear that in one ear or both.
Both.
Both ears. Okay. Now we're going to do a test on hearing for her air conduction versus direct conduction. Air conduction should be 2 times that of direct conduction. So a quick tap here. Can you hear that?
Yes.
Okay, tell me when you can't hear it anymore.
Can't hear.
Okay, timing that. Let me know if you can hear this.
Yes.
Okay, tell me when you can't hear it anymore.
Can't hear it anymore.
Okay, and same thing over here. Tell me if you can hear this.
Yes.
Okay, and timing it again. Tell me when you can't hear it anymore.
Can't hear it.
Okay, and continuing on. Can you still hear it?
Yes.
Okay, tell me when you can't hear it anymore.
Can't hear it.
Okay, so there again, the timing should be 2 times that. Okay, I'm going to go ahead, inspecting both my ears. They're symmetrical, they're even. There's no scarring. There is this macule here in the ear. The tragus is flexible, the cartilage is flexible. They are pierced. I'm going to go ahead and look inside now. The tympanic membrane, a little bit of cerumen, terminal hairs here. The tympanic membrane is gray opaque. Can see where the malleus bone touches. My light cone is at 5 o'clock. No redness, no bulging noted. Same thing over here. Going in, I see some cerumen, some terminal hairs. The tympanic membrane is gray opaque. Can see where the malleus connect. And my light cone is at 7 o'clock. The membrane is not bulging. Whisper test. And then we would conduct our whisper test. I'm going to go ahead and cover this ear. I'm going to whisper something into my patient's ear and ask if she can hear me. And
it's hot outside today.
She's going to repeat what I say over here.
We're going camping.
So she copied both of those. Prior, I shouldn't say prior, during the exam we would conduct a vision test, both a Snellen's and Rosenbaum's. We would have the patient read the Snellen's chart from 20 feet away, testing her distant vision. Start at the highest, working down one eye at a time, then both do uncorrected and corrected. Happen to know this patient well. She wears glasses. The other thing we would do is our Rosenbaum, where we have our patient hold the eye chart out in front of them and read it at 14 inches, checking her near vision. Same thing, start at the top, work her way down. One eye each, and then both eyes corrected and uncorrected. We would, of course, darken the room, turn on our ophthalmoscope, and we're checking for the red reflex. which would be hopefully positive. If we were in a darkened room, it would be obvious. I'm going to go ahead and blind my patient here for a little bit. I'm going to move in, and I am looking at the back of the eye. I am looking at the vasculature back there. It is clear. It does not cross. Looking for the optic disc and the fovea centralis. The fovea centralis is yellowed, small, not seeing any lesions. I'll let her recoup there for a second and switch eyes. We're going to come in from the nasal side first. And, you know, where is it? Here again, looking at the back of the eye, I can clearly see the vasculature. The fovea centralis is visible, a small yellow disc, and the optic disc as well is visible. Not seeing anything unusual with the vasculature, not seeing any lesions. So, once my patient recoups on that vision a little bit, going to ask her to pick a spot out there, kind of far out. Have her quickly change her focus to my pin light, and then follow it into her nose. So go ahead. Okay, and follow it into my nose. I'm checking the accommodation, the pupils adjusting for the changes in the vision there. Looking at her eyes, her irises are blue, her pupils are round, they're equal. The sclera are clear, her conjunctiva are a lovely pink red, showing that her hematocrit, hemoglobin, good counts there on her blood. She's not anemic.